my god. Brian,
Oh, Riley.
is it bad?
I'm so sorry.
Is it bad? Tell me if it's bad.
Oh, it's pretty bad.
Oh.
I need an ambulance. It's been an emergency.
Oh, me
Please
leg.
come quick.
2 days later.
Riley, mate, how you going?
Brian, good to see you.
How's your leg? What happened at the hospital?
Oh, look, mate, clean break of the tibia and the fibula. They're giving me 15 milligrams per 1 milliliter of morphine sulfate administered via intramuscular injection for pain relief.
Is that all they gave you?
Nah, they gave me a script for Momex SR. Gotta have 30 milligrams every 8 to 12 hours, depending on the pain severity. But you know, I'll take a little bit more because it makes me feel good.
Oh, mate, what's all this alcohol for then?
Oh, you know me, mate.
Don't you know alcohol and morphine don't mix very well together?
What are you talking about?
Oh, morphine's a strong opioid in the involvement by further inhibition of the CNS. It increases inhibitory effects of GABA and excitatory effects of glutamate. It can kill you if you're not careful.
Wow, it'll be right. What's the worst that can happen?
I will remember you.
Breaking news, a 46-year-old man has tragically lost his life due to the harmful effects of a morphine overdose. Morphine is a member of the narcotic opioid pain reliever drug group, and a morphine addiction can develop easily, just like in the case of the young construction worker. We are live now with corresponding expert Nicole to explain the harmful dangers of morphine. So Nicole, what is morphine?
Thanks, Megan. So morphine is an opioid and is the most potent analgesic used in the treatment of chronic pain. But its use is limited due to the induction of tolerance, several withdrawal symptoms, and high risk of relapse and abuse. It acts on presynaptic neuronal membranes to inhibit neurotransmitter release and blocks nociceptive signals which activate pain-modulating neurons. Medically, it is an agonist of U receptors in the CNS, and these central receptors are found in the medulla, where the respiratory center is located. Consumption of morphine leads to carbon dioxide being reduced, thus leading to decreased respiration.
Thank you for that insight, Nicole. So what are the pharmacodynamics related to this drug?
So the binding of morphine in the opioid receptors blocks the transmission of nociceptive signals. It activates the signaling of pain-modulating neurons in the spinal cord and inhibits the transmission from primary afferent nociceptors to the dorsal horn sensory projection cells. The excessive consumption of morphine and opioids in general can produce changes in the synaptic neuroplasticity, mainly in the postsynaptic sites, dendritic terminals, and may lead to modifications in neuron density. It produces analgesia, decreased gastrointestinal motility, respiration depression, drowsiness, changes in mood, and alterations of the endocrine and autonomic nervous systems. Nausea and vomiting may occur through direct stimulation of the chemoreceptor trigger zone.
Can you tell us anything about the pharmacokinetics of this drug?
So there's a fairly rapid onset of morphine, with peak analgesia occurring within 20 minutes or 30 to 90 minutes after an injection. It is absorbed in the gastrointestinal tract and is distributed throughout the body, particularly to the kidney, lung, liver, and spleen. Lower concentrations are found in skeletal muscle and brain tissue. Approximately 35% is protein-bound, mainly albumin, and it diffuses across the placenta. It is metabolized principally in the liver by conjugation and glucuronic acid. It has poor bioavailability due to extensive first-pass metabolism in the liver and gut. The elimination half-life from the serum is approximately 1.5 to 2 hours in healthy subjects. 90% of the dose is recovered in urine with 24 hours. Around 7 to 10% of the dose is recovered in feces, majority after conjugation and excretion via bile.
Thank you, Nicole. Any final comments for the viewers listening out there?
So although throughout this man's recovery, morphine would have been very effective for his drug relief, however, there's many precautions that need to be taken for those who are prescribed with the drug. Major hazards associated with morphine include respiratory depression and arrest, circulatory depression, shock, cardiac arrest, hypertension, sedation, and seizures.
Thank you, Nicole. This has been Megan McCurdy. We'll see you tomorrow night.